Hello friends, today we will discuss one more topic of head, neck and face. It is pharynx. Conventionally, pharynx is taught into two lectures because it is a lengthy topic. We will proceed with the same fashion. So let's go to our video. So the topic is pharynx part 1. So before starting the topic, I want to ask you one question. Have you learned histology of GID? Any organ, that is small intestine, large intestine, esophagus. So if you remember, it is having four layers, that is mucosa, submucosa, muscularis externa and serosa. Pharynx is nothing but a muscular tube only, and it will also have similar layers, mucosa, submucosa, muscularis externa and serosa, with certain differences. So there are four layers in a luminal GIT viscera. These four layers are mucosa. In pharynx, it's nothing but mucous membrane. Next, we have submucosa. In pharynx, the submucosa is in the form of pharyngobasilar fascia. It is thickened to form pharyngobasilar fascia. Then we have muscularis externa, but we have to remember that in GIT, there is smooth muscle in the muscularis externa, but in the pharynx, here we have got skeletal muscle. It is in the fashion of inner circular, outer circular and inner longitudinal. So in the pharynx, in the GIT, we have got smooth muscle, but in the pharynx, we have got skeletal muscle in the fashion of outer circular layer and inner longitudinal layer. Remember, it is skeletal muscle, not smooth muscle. Then we have serosa, which is in the form of buccopharyngeal fascia. So this is a side-by-side comparison of four layers of any GIT luminal tube with the pharynx. So like our routine, we have to discuss any topic under the various headings. So what to learn in pharynx? It is a quite bit lengthy topic. We will discuss the extent, location, dimensions, boundaries and relations of each of the subdivisions. So the subdivisions are nasopharynx, oropharynx and laryngopharynx. Then we will discuss the composition of wall of the pharynx, which we have briefly discussed in the previous slide. Then we have got the muscles of the pharynx, their origin, insertion, nerve supply and action and their arrangement. Then what are the structures passing through the gap between the various muscles of the pharynx. This is a very important topic. It can be asked as a short note or draw a well-labeled diagram. So we have to focus on this particular part of the pharynx. Then we will discuss blood supply, nerve supply, lymphatic drainage and applied anatomy. So basically, what is pharynx? Like I have just mentioned, pharynx is a funnel-shaped fibromuscular tube. So it is a fibromuscular tube. It consists of fibrous tissue and skeletal muscle, as we have already discussed. It is lined internally by mucous membrane. This also we have discussed, and it is a common channel for passage of air as well as food. What is the extent of the pharynx? The pharynx, it extends from superiorly base of the skull to the pharyngoesophageal junction up to the esophagus. So inferiorly it extends up to the esophagus. Let us revise once again. It extends superiorly from the base of the skull up to the esophagus. So the lower end of the pharynx is at the level of lower border of cricoid cartilage or at the lower border of C6 vertebra. In other words, esophagus begins at this level, at the level of cricoid cartilage and the lower border of C6 vertebra. The junction is called as pharyngoesophageal junction. So what is the location of the pharynx? It is located in the midline and it is behind the cavities of nose, mouth and larynx. Let us see a video to understand the exact position of pharynx. So the pink colored tube, it is pharynx, and we can see the sixth cervical vertebra is at the junction of pharynx and the esophagus. It is pharyngoesophageal junction. Now let us see the labels. So cricoid cartilage and C6 vertebra at the pharyngoesophageal junction. This is the esophagus highlighted in green color, and we can see the three subdivisions: nasopharynx, oropharynx and laryngopharynx. This is a basic schematic diagram to show the various apertures in the pharynx, the various subdivisions, that is nasopharynx, oropharynx and laryngopharynx. So let us learn while drawing. Let us start with the roof of the pharynx, then the posterior wall of the pharynx, then floor, the oral cavity. Let's show the hard palate, nasal cavity, oral cavity, nasal aperture, isn't it? And the posterior nasal aperture, the junction of oral cavity and oropharynx, it is called as oropharyngeal isthmus, whereas the junction of nasopharynx and oropharynx, it is called as nasopharyngeal isthmus, or it is also called as pharyngeal isthmus. We can also see the laryngeal inlet. So the anterior tube, it is larynx, and posteriorly there is laryngopharynx. So this is a highly schematic diagram. This is for the basic understanding. Now we will see the passage of air and passage of food. So the air, it passes towards the larynx, and food, it passes towards the esophagus. So we can see what are the measurements of pharynx. Measurements of the pharynx. Length of the pharynx is 12 to 14 centimeter. Width in the upper part, it is 3.5 centimeter. In the upper part means near the base, and 1.5 centimeter at the pharyngoesophageal junction. The peculiarity of this part is it is the narrowest part after the appendicular orifice. So if appendicular orifice is not given in the option, you have to choose pharyngoesophageal junction as your correct choice in multiple choice question. So the narrowest part of the GIT after appendicular orifice is pharyngoesophageal junction. So we have seen the schematic diagram. Now let us see what we should draw. We should draw this particular diagram instead of a schematic diagram. So you will get at least few marks if you don't remember the detailed diagram. You should show the nasal cavity, oral cavity, nasopharynx, oropharynx and laryngopharynx. So let us see how to draw this diagram. We will begin with drawing the nose and lips and chin. We will draw the hard palate. Then we will draw a soft palate behind it. It will be better if you draw along with the session so that you will practice the diagram. Then we will draw the tongue along with the epiglottis. Continue it downwards as the larynx. Draw the larynx and show the cricoid cartilage as the lower end of the pharynx. We already discussed. Now show the roof of the nose or nasal cavity to the roof of the pharynx and the posterior wall. Now draw the isthmus, which is the posterior nasal aperture. Posterior nasal aperture in between nasal cavity and nasopharynx. Then it is the oropharyngeal isthmus between oral cavity and oropharynx. I haven't shown the pharyngeal isthmus. Now let us discuss boundaries and relations. Superior and inferior boundaries we have already discussed, base of the skull and the pharyngoesophageal junction. Now we will discuss anterior, posterior and lateral boundaries. So posteriorly there is prevertebral fascia. The prevertebral fascia, in between the prevertebral fascia and pharynx, there is a layer of loose areolar connective tissue because of which the pharynx can freely move. Anteriorly, it communicates with the nasal cavity, then it will communicate with the oral cavity and it will communicate with the larynx. We have seen these three openings. Anteriorly, it communicates with the nasal cavity, then the oropharynx, it will communicate with the oral cavity or mouth, and laryngopharynx, it will communicate with the larynx. On each side of the pharynx, laterally, we know there is carotid sheath. On each side of the pharynx, there is carotid sheath. It is also known as neurovascular bundle of the neck and the styloid process with the styloid apparatus. These are important relations. What are the subdivisions? So right from the beginning, we have been many times repeating the subdivisions. These are nasopharynx, oropharynx and laryngopharynx. Now what exactly to be drawn? We have to draw this diagram. So this diagram is the crux of this topic. If you draw this diagram, if you practice this diagram, the main bulk of the pharynx is over. So drawing this diagram, you can write down the anterior, posterior boundaries of each of the nasopharynx, oropharynx and laryngopharynx and many of the external features you can write down. Let us see how to draw this diagram. Before drawing the diagram, let us see an animated sagittal section. We can see the sagittal section and it shows all the three subdivisions of the pharynx: oropharynx, nasopharynx and laryngopharynx. So it might seem difficult, but we will draw step by step, and at the end of the session you will be able to draw the pharynx with confidence. Basically, it is the same diagram that we have drawn previously, but we have added some additional features which are seen in the sagittal section. Let us proceed drawing the nose, lips, chin. I hope you are drawing with me. So let us show the frontal bone with the frontal air sinus. Draw the ethmoid. Behind the ethmoid, show the sphenoidal air sinus, body of the sphenoid, and the occipital, basilar part of the occipital bone, which is placed in front of the foramen magnum. Now show the hard palate. I haven't labeled it because I have already labeled it in the previous diagram. So let us draw the hard palate. Posterior to it, show the soft palate. Draw tongue along with the epiglottis. Now show anterior arch of the C1 along with the odontoid process of the C2. So I have drawn C1 and C2. Complete the remaining vertebrae, that is C3, C4, C5 and C6. You have to draw up to C6 because the pharynx ends at the level of C6. Show the laryngeal inlet, draw the larynx, draw the cartilages, thyroid and cricoid cartilages. Show the pharyngoesophageal junction. Now complete the sphenoid, body of the sphenoid. Show the concha in the lateral wall of nose. In the roof of the nasopharynx, show nasopharyngeal tonsil with nasopharyngeal bursa. Show auditory tube surrounded by tubal tonsils. Show two folds, salpingo-palatine and salpingo-pharyngeal fold extending from the tube. Behind the auditory tube, show pharyngeal recess, which is also known as fossa of Rosenmuller. Now draw posterior wall of the pharynx. This complete the nasopharynx, the internal features of the nasopharynx, which we see on a sagittal section. Now let us see what we are able to see in the oropharynx. Draw the palatoglossal and palatopharyngeal folds. In between these two folds, show palatine tonsil. Also on the posterior third of the tongue, show the lingual tonsil. So here we have got nasopharyngeal tonsil, tubal tonsil, palatine tonsil and lingual tonsil, and they will form a circular ring which is called as Waldear's lymphatic ring. So it is important component of the pharynx. As we have drawn the sagittal section now, we are familiar with the features of pharynx. Now let us discuss theoretically, because you have to write also few things apart from drawing the diagram. You have to write also. So let us discuss few things about each of the subdivision. So nasopharynx, what are the boundaries of the nasopharynx? You can see the diagram and name the boundaries. The roof, it is base of the skull. Floor, it is soft palate and pharyngeal isthmus, as you can see in the diagram. Anterior wall, it is formed by the posterior nasal apertures, and posterior wall, it is formed by the anterior arch of the C1 vertebra. All these things you can correlate with the diagram. We have already seen how to draw the diagram. Lateral wall, it is medial pterygoid plate, which is not shown in the diagram. It cannot be shown. So you have to remember the laterally it is medial pterygoid plate. So what are the features of the nasopharynx? Very important. I have marked it with 5 stars. It is nasopharyngeal tonsil, nasopharyngeal bursa, which is also known as pouch of Lashka. Then opening of auditory tube, which is also known as pharyngotympanic tube or eustachian tube. Tubal tonsils and pharyngeal recess, which is nothing but a depression behind the tubal elevation. It is also known as fossa of Rosenmuller. So we have basically enumerated these features. We will see the details of these features in the next slides. So first is nasopharyngeal tonsil. So nasopharyngeal tonsil is nothing but a collection of lymphoid tissue placed at the junction of roof and posterior wall of the nasopharynx. Sometimes there is a remnant of Rathke's pouch which is present just above the pharyngeal tonsil. I have not shown in the diagram. In your standard textbook, you may find they have shown a Rathke's pouch remnant just above the pharyngeal tonsil. Next feature, it is nasopharyngeal bursa. The nasopharyngeal bursa, it is also known as pouch of Lashka, and it is nothing but a mucous diverticulum extending into the nasopharyngeal tonsil. You can see in the diagram there is a mucous diverticulum extending into the nasopharyngeal tonsil. And what it signifies? It signifies the attachment of notochord with the pharyngeal wall. Next feature, it is the opening of auditory tube. This is also a viva question. Where is the opening of auditory tube is situated, and multiple times MCQs have been asked on this topic. So the opening of the auditory tube, it is located in the lateral wall of nasopharynx, and it lies behind the inferior nasal concha of the lateral wall of nose. So the exact location, it is 1.25 centimeter behind the inferior nasal concha in the lateral wall of the nasopharynx. This opening is surrounded by lymphoid tissue which is known as tubal tonsil, and from this opening of the auditory tube there are two folds. One fold is running towards the palate and one fold is running towards the pharynx. These folds are called as salpingopharyngeal fold, which consists of salpingopharyngeus muscle, and next is salpingopalatine fold, which consists of levator palati muscle. So here we have got two folds, salpingopharyngeal fold with the muscle that is similar to the name of the fold, but salpingopalatine, it is different, so you have to remember it particularly. Salpingopalatine fold, it is raised by levator palati muscle. What are the features? Next features, it is the pharyngeal recess or fossa of Rosenmuller. It is nothing but a depression present behind the opening of auditory tube. So I will discuss one important applied aspect here only, that is adenoids. So whenever the nasopharyngeal tonsils are enlarged, these are referred as adenoids. The reason may be infection. So remember, adenoids, these are enlarged nasopharyngeal tonsil. So you have to remember the word nasopharyngeal because multiple choice question will be asked, which of the following tonsils, when they are enlarged, they are called as adenoids. So there will be four options: palatine tonsil, lingual tonsil, tubal tonsil, and nasopharyngeal tonsil. Your answer should be nasopharyngeal tonsil. Next, we will have oropharynx and its boundaries. What are the boundaries? Roof is formed by soft palate, obviously, and pharyngeal isthmus, which separates nasopharynx from the oropharynx. So here we will again revise the pharyngeal isthmus and oropharyngeal isthmus. So pharyngeal isthmus or nasopharyngeal isthmus, it separates nasopharynx from the oropharynx, whereas oropharyngeal isthmus, it separates oral cavity from the oropharynx. Floor of the oropharynx, it is formed by posterior one-third of the tongue, which consists the lingual tonsil, we have already seen and drawn in the diagram, and epiglottis. Oropharynx, anteriorly, it communicates with the oral cavity through the oropharyngeal isthmus, and there will be pharyngeal part of tongue anteriorly. Posteriorly, it is related to the body of C2 and C3 vertebra, and laterally it is related to the pterygomandibular raphe and hyoid bone. So the hyoid bone, it is a C-shaped bone. The two cornu of the hyoid bone, it will be placed on each side of the pharynx. The body of the hyoid bone is in the midline, but the two cornus on each side of the pharyngeal wall. And pterygomandibular raphe, if you remember, it arises from, or it is attached, one end is attached to the medial pterygoid plate and another end is attached to the mandible, that is the lingula of the mandible. So it is pterygomandibular raphe and hyoid bone present in the lateral wall of the oropharynx. So what are the features of the oropharynx? In the lateral wall, we can get palatine tonsil in between palatoglossal arch and posterior palatopharyngeal arch. We have drawn this in the diagram. Refer to the diagram please. And in the anterior wall, we can see the lingual tonsil on the posterior 1/3 of the tongue and upper free end of the epiglottis. The epiglottis is connected to the tongue via 3 folds, median glossoepiglottic fold and 2 lateral glossoepiglottic folds. And in between the median and lateral epiglottic glossoepiglottic folds, there are depressions which are known as epiglottic valleculae. These are the features of oropharynx. Now let us discuss what is oropharyngeal isthmus. So from the diagrams, it is very well established what exactly oropharyngeal isthmus is. We have already discussed what is oropharyngeal isthmus. It separates oral cavity from the oropharynx. So it is the communication between oral cavity and oropharynx. It is an arched opening between the two palatoglossal folds. This is another description or another way we can define the oropharyngeal isthmus. What are the boundaries? Above it is a soft palate, below it is a posterior 1/3 of the tongue. So this is nothing but revision of oropharynx, features of the oropharynx. Laterally there is palatoglossal fold which comprises or which lines the palatoglossus muscle. And what is the role of the oropharyngeal isthmus? It prevents regurgitation of food from pharynx, that is oropharynx, into the oral cavity, from pharynx to the mouth. And which isthmus it prevents the passage of food into the nasal cavity? It is pharyngeal isthmus or nasopharyngeal isthmus, situated between nasopharynx and oropharynx. It prevents the passage of food from oropharynx to the nasopharynx. So these are the differences between oropharyngeal isthmus and nasopharyngeal isthmus. Now let us discuss laryngopharynx. What are the boundaries? Superiorly, it is the upper border of the epiglottis, and inferiorly, we know the inferior boundary of the pharynx itself. It is lower border of cricoid cartilage. It is also known as pharyngoesophageal junction. It is nothing but a revision. Anterior wall, it is showing laryngeal inlet. This also we have seen in the diagram, and the posterior surface of the larynx. Posteriorly, there is C3, C4, C5 and C6 vertebrae which are forming the wall of laryngopharynx. Laterally, there is thyroid cartilage and thyrohyoid membrane. So the thyroid cartilage, it is a shield-like cartilage which is having two laminae attached anteriorly, and the posterior borders, these are free borders. What are the features of the laryngopharynx? In the anterior wall, it shows laryngeal inlet, and in the lateral wall, it shows an important structure known as pyriform fossa, which is also known as smuggler's pouch. So at this stage, we will comment on the pyriform fossa. We will not discuss in detail because it will be discussed in detail with the interior of the laryngeal cavity. So here we are just mentioning the pyriform fossa is present in the lateral wall of the laryngopharynx, and why it develops, it is due to the projection of larynx into the laryngopharynx, or we can say it develops due to the bulging of the larynx into the laryngopharynx. So we will see in a diagram this pyriform fossa, and we will discuss it in detail in the lecture of larynx. Sometimes you may get a question to draw the posterior view of the pharynx to show the anterior openings through which the pharynx communicates with the nasal cavity, oral cavity and the larynx. So these communications can be shown while drawing a posterior view of the pharynx. We have to remove the posterior wall of the pharynx so that we are able to see the anterior openings. So we will see it first, what we have to draw. So we have to draw this diagram. You must be finding it difficult, but we will see a very easy way to draw this diagram. Once we understand what exactly this view is and what are the structures to be drawn, it will be a easy diagram for you. So this is an animated view showing the posterior wall of the pharynx which has been removed so that we can see the anterior communications of nasopharynx, oropharynx and laryngopharynx. Let us see the important highlights of this diagram. So we can see the medial nasal septum and the lateral wall of the nose. Also we can see the soft palate, uvula. Then we can see the oropharynx, mucosa of the oropharynx, then tongue, then tonsil placed in between the palatoglossal and palatopharyngeal folds. Then we can see the opening of the larynx, laryngeal inlet, and the pyriform fossa. So the pyriform fossa, it is a highlighted structure. So what we have seen or studied in the video, that is same thing we have to draw here. So we will draw a very basic schematic diagram. Let us learn how to draw this diagram. We will begin with base of the skull. We will draw the base of the skull. Next, we will draw two posterior nasal apertures or posterior nares. There is medial nasal septum in between these two. Then we will show the concave projecting from the lateral wall into the nasal cavity. These are concave. Draw the lateral wall of the pharynx with the drawing of tongue. So this is the soft palate. These are palatoglossal arches. This is epiglottis. Then we have to draw the tongue. Now show the palatoglossal arches, and in between the palatoglossal and palatopharyngeal arch, show the palatine tonsil. So I hope you are able to correlate the diagram. This is soft palate, palatine tonsil, tongue, and epiglottis. Now draw the array-epiglottic fold from epiglottis to the arytenoid cartilage. Complete it with the interarytenoid folds, and on each side of the array-epiglottic fold and the thyroid membrane, in between thyroid membrane, there is a depression. This depression is called as pyriform fossa. So these are features which we can see in the posterior wall of the pharynx or posterior view of the pharynx. Thank you for watching the session. I hope it was a easy session and a fruitful session. Remember, we have discussed only part 1 of the pharynx. The things yet to be discussed in the topic of pharynx, these are muscles, the structure passing through the gap in the wall or of the muscular wall of the pharynx, the blood supply, lymphatic drainage, venous drainage, and nerve supply, and few of the applied aspects. So we will soon upload the part 2 of the pharynx lecture. Till then, goodbye.